So before you begin a chair massage, a chair sequence, make sure that you have done a very brief intake with your client. Make sure you ask about medications, any previous injuries that they've had, and then maybe ask them if there are any areas of the body that you would like for them to focus on. So listen to your client very carefully for their chair massage. Be sure that you have adjusted the chair to fit the client's height. You'll probably be changing the chair many times for different clients. Also make sure that you've put paper towel or some type of face cradle cover over the face cradle for the client when they put their face in. And then we're ready to start. Be sure, two other things, that the neck, when you push on the neck, that the neck is going to stay straight, and that the low back is relatively in a straight position here as well. As we do compressions down the back, we want to make sure that the back stays in a straight position as well. So we're ready to start. We're going to start with a nice resting position. It's very important to use good body mechanics. Mechanics are going to be different with chair massage than they are with table. So you're going to be able to really have a deep lunge, and you're really going to be able to put your body weight onto the client as we go. So I'm going to be in a nice lunging position. Just lay my hands on the client, and again ask them to take some nice deep breaths in as we do a resting position. Again, just for them to feel your initial touch. And after a couple of deep breaths, I'm going to do just a little bit of stroking. Again, to relax the client, kind of tell them where I'm going to be working. So I'm going to be focusing on the back. And then come back to the top, and I'm going to start with open palm compressions as I work down each side of the spine. At about midway down the scapula, you'll notice that my wrists are starting to hyperextend, and I want to be careful of that. So to continue with my compressions, I'm going to make loose fist, and I'm going to continue my compressions down each side of the spine. All my weight is on my back foot. I'm in a nice lunge. I'm just basically putting all of my weight into the client. Once I reach the low back, I'm going to come back up, moving slowly, again, nothing fast. As I get to the top, I can then go back to those open palm compressions that will get me back up to the top of the shoulders. Once I'm there, I'm going to do a technique where I'm going to pull the shoulder towards me gently, then squeeze with the thumbs, and then I'm going to lean forward and roll everything forward. So I'm going to start by the neck, kind of pull the tissue forward towards me, push with my thumbs, and then roll the tissue forward. So you grabbing upper traps and moving it forward. Move my hands laterally. Pull, push with my thumbs, roll the tissue forward. Check with your pressure, is that okay? Mm-hmm. Pull with the fingers, squeeze with the thumbs, roll everything forward. And then work my way back medially. So it's basically a pull and a push. Pull with my fingers, push with my thumbs, roll everything forward. One more time. Pull, push, roll everything forward. I'm then going to step to one side so that I can start working on one side of the back. If the shirt starts to come up, just stop for a moment, pull the shirt back down. So I'm working contralaterally to where I'm standing. I'm standing here, but I'm working on this side. One hand is going to stay up here in the trap, and this hand is going to travel down the back. So I'm going to squeeze here, release it, and then push on the medial border of the scapula. Release that. Squeeze again in the shoulder as this hand travels down the back. Now, the spine is here, so I'm on the opposite side of the spine. So squeeze on the shoulder, and then release it and push. Squeeze, push, squeeze, push, and then work my way back up. Squeeze, push, now when I'm back up in the shoulder, I can do squeeze kneading. I can do it over the shirt, or I can ask the client if I can come underneath their shirt collar so that I'm kind of partially on skin. So just like we do on table work, I'm going to squeeze knead right here in the upper traps. Again, very slowly. Remember, with chair massage, we're not using any lotion because the client obviously is dressed, and we're not worrying about draping. So I'm not using any lotion. So anytime we are on the skin, I do want to move slowly. So just back and forth with our squeeze kneading right in the traps. All right. Again, focusing on this one side, I'm going to step over here on the side I'm working, make a loose fist, and I'm going to start with some nice loose fist petrissage right next to the spine. About 3 or 4 circles in one spot. Again, all my weight's on my back foot. My left knee is bending as I move. Remember, circular kneading is happening with your legs moving, not your shoulder. And I'm just slowly going to work my way up the back. I'm right between the scapula and the spine at this point. And if you will notice, I took a step up to get myself a little bit closer to the client. Again, keeping your head up. Good body mechanics as you work. Now that I'm up at the shoulder, I'm going to come in with my forearm compressions. So I'm going to lay my forearm, so I'm still facing forward, lay my forearm right between the shoulder blade, the scapula, and the spine, and come in with a nice forearm compression. Again, I just lean forward. You can gently rock the client side to side if you wish. Pick the forearm up, push in again, move it side to side. Remember to keep your wrist nice and relaxed. Don't have any tension in your wrist because the client will feel that tension. And then I'm right at the very top. I'm at basically the crest of the shoulder. When I'm there, I'm going to lay my forearm right on the shoulder, and I'm going to move back and forth, kind of almost like a seesaw, with some good pressure right in that upper trap. Just back and forth, pushing in and down, back and forth. If I want to get a lot more specific and a little bit deeper right in this area, I'm going to come in with an elbow with my olecranon process. But to do that, so that when I'm doing the circles here, I'm not making them too big or sliding around, I'm going to make sort of like a little cup and put my elbow inside that. So I'm going to do some elbow petrissage. Is that pressure okay? Mm-hmm. Just kind of move it around right between where the rhomboids are, where the erectors would be. Kind of lift it up and just work up the medial border of the scap. Again, my elbow is right between the shoulder blade and the spine. Again, I'm right almost at the top of the shoulder again. If you feel a flip right in there, remember you're probably right on levator scapula, the insertion of levator scapula. And now I'm basically right on top of supraspinatus. Okay. kind of work my way out of that. Take the arm off the side of the chair, and I'm going to do a shoulder mobilization. Basically exactly what we do on the table, but in the chair instead. So with the arm hanging, I'm going to bring my hand and arm closest to the client, between their torso and arm, and cup underneath the shoulder. My client will relax, and I'm going to place my outside hand on top of the scapula. And remember, using your legs here, really exaggerate the movements here. Okay? So kind of almost pull the shoulder towards you, up towards the ceiling, and then back down. Change directions. And then I'm ready to traction. I got really nice and deep right in between the shoulder blade and the spine, so now I want to traction the shoulder. So I'm going to turn and put my body facing the client. I'm going to put my shin on the chair, or holding the chair. Take the client's elbow and put it in my elbow, and then just lean back. Is that okay? Mm-hmm. Tractioning that shoulder. You'll notice the head will move in the face cradle a little bit. Have them maybe take a nice deep breath in. And after they exhale, then just slowly let the arm come back and let it hang to the side. I'm going to begin my upper extremity work. Depending on what the client has on, you can always ask to roll up that shirt sleeve so that you can uncover a little bit more of the tissue to work on. So I'm going to work from the deltoid muscle all the way down to the wrist and even into the fingers if I want. So wrapping my fingers completely around the arm, I'm going to do two things. I'm going to push the arm towards the client as I use my thumb and palms to spread the tissue open. So it's pushing in, and as I push towards the body, kind of gives me a little bit of leverage. So push the arm towards the client and then kind of spread open the tissue as you go down. And I'm going to do this down the entire length of the arm. So I've skipped the elbow, of course, and just come down into the forearm. Going all the way down into the wrist, to the carpal bones. I can even use my thumbs right on the wrist and just kind of spread that tissue open with my thumbs. Another nice technique here. Here are the extensors of the forearm right here. I can put my thumbs together right between the radius and the ulna and kind of just push, do some thumb pad compression and hold it and then release it. Push in, hold it, and release it. If you are doing a chair massage event at an office, many of your office workers that come to you are going to probably have very tight extensor muscles in the forearm for all the desk work that they do. So this would be probably a very good option to work with that kind of a client. Okay. Depending on your time, you could work into each finger if you wanted to do that. Last thing I'm going to do for the arm is kind of a little bit of a mobilization. I'm going to start up next to the axilla or the armpit, and I'm just going to very quickly move my hands back and forth and just come down the arm all the way to the wrist, Come back up. Do this maybe once or twice. Just really relaxing to that whole shoulder, because you can see it's affecting the shoulder, the wrist, that entire upper extremity. I'm going to put that arm back on the armrest, and then I can start my work on the second side of the client. So after setting the second arm on the armrest, I'm going to come to the front of the chair. Using my palms, I'm going to hook on the front of the shoulders. My fingers are just going to rest back here. And I'm going to do some compressions this time, kind of just pushing up. So I'm using my fingers to kind of squeeze the traps as I push up sort of towards the ceiling here. And it's just alternating back and forth into the shoulders. You can move out a little bit laterally as you go, and then you can move back in if you wish, kind of moving more medially. I'm going to step to the side of the chair, and I really want to specifically work on the neck. We haven't really done anything in the neck. So I'm going to put my thumbs on one side and all my fingers on the other. And you need to get to skin here. So if you need to, you can kind of push the collar down a little bit of the shirt, kind of like you're just coming right down on the posterior neck, right on the skin. You're going to squeeze, thumb and fingers, squeeze everything together, and then lift up towards the ceiling, and then slowly separate your hands apart. As you can see, I've got a lot of kind of muscle and skin as I separate my hands, nice and slow. Again, this is dry, there's no lotion. Release it, go back in, squeeze all the fingers and the thumbs together, kind of lift up, and then separate your hands apart. Nice and slow. One last time, usually about 3 times is nice. Try to lift and squeeze as much as you can. And then just kind of separate your hands apart. You can also do some scalp work if you wish to incorporate scalp work into your treatment as well. So I'm going to come to a close. I'm going to go down the back with another set of compressions, just to readdress the back again. Come back up. Again, one last time, if you want to do a little bit of kneading, you can. Again, the beauty with chair massage, just like table massage, is, you know, make it whatever it is you want to make it. Use whatever techniques you want to use. There's not a rhyme or a reason to it. Just make it, you know, treat the body systematically like we would with table work, but just make it whatever you want to make it. And again, depending on what the client has requested, areas that they want you to focus on, incorporate techniques that would be useful to use in that area. Do my pull, squeeze, roll a couple more times just to address those traps one more time. And then depending on if you want to use tapotement, you can. I'm going to use a light, very light cupping technique for my tapotement. So remember, with cupping, you're making kind of cups with your hands. Again, this should just be just very light. I'm going to step to one side, come down the back. Remember, tapotement is kind of a stimulating technique, so if they're having to maybe go back to work after a chair massage, this could be just something that, after being a little bit relaxed, is just going to kind of energize the client a little bit. Okay, again, very light, nothing heavy, just a light tapotement. Kind of just brush the back off a little bit. And then when I want my client to sit back in the chair, I want to hold on to the paper towel so it doesn't stick to their face. So I'm going to ask the client to slowly sit back as I hold on to the paper towel. And just set that down. And then I'm going to come back around to the back of my client, and I'm going to do a couple of stretches. Once I have my client seated back in the chair, I'm going to do just a couple of very nice stretches for the neck to end my treatment. So I'm going to take my right hand and hold the right shoulder down. Bring my left hand over, place it on the side of the head, bring their left ear to their left shoulder, and then, if I want to get a little bit of a better stretch, I can just kind of bring their nose towards the floor, bring the head into a little bit of flexion. Is that comfortable? Have them take a couple of deep breaths in. And remember, after that second breath, don't let them bring their head back to center. Just release this shoulder, place one hand on each side, bring the head back up for the client. Then I'm going to put my left hand on the left shoulder, right hand comes over, and I'm going to bring the right ear to the right shoulder, kind of point that nose towards the floor. Have the client take a couple of nice deep breaths. Just breathe into that neck. Again, after that, a couple of good breaths. Place one hand on each side, bring them back up, and then remember to have the client get off the chair slowly, and it's a good idea for you to come to the front of the chair, hold it, maybe put a foot on the base or hold on to it, and then the client's going to get up off the chair